Hi, my name is Dave Wallach with Americans for Responsible Growth. We're an advocacy organization that works with state treasurers, comptrollers, controllers, and other financial officers around the country. Today we're doing a press conference on the impact of the cuts to Medicaid and others of Congress's and President Trump's actions that are having an impact on states and the people and businesses and communities in those states. Today we have five, we're going to have one more showing up here soon, 5 state treasurers who are going to be speaking. We have Mike Frerichs, the treasurer of Illinois, Laura Montoya, the treasurer of New Mexico, Erick Russell, the treasurer of Connecticut, Mike Pellicciotti, the treasurer of Washington State, and Mike Pieciak, the treasurer of Vermont. So we'll go ahead and get started. Treasurer Frerichs, why don't you start us off?
Hi, I'm Mike Frerichs, the Illinois State Treasurer. We're here today as State Treasurers sounding the alarm of what cuts to Medicaid will mean in our states. President Trump and the Republicans in Congress are pushing for cuts to Medicaid. Now, some people might say, I don't use Medicaid, but many of our constituents do. This will be impactful on them. But it will also cause real pain for our hospital systems. And in the state of Illinois, whether your hospital is on the west side of Chicago or the western part of the state, this will have devastating consequences. Access to health care will be decreased as a result of these cuts. And the public ought to know this before these cuts are allowed to take place. In many smaller areas and rural areas in our state, the hospitals are the largest employer in the area. This is going to have an economic consequence. Now, some of these people ran for office saying they want to increase economic activity, lower prices. What they're going to be doing is increasing prices that people are going to have to pay and decreasing opportunities. We, as treasurers, care very much about economic activity in our states. We look very closely at budgets. And what this is the federal government passing down costs to the states and ultimately to consumers. They're going to pay more. They're going to get worse quality health care. And someone needs to ring the alarm bell. And I'm very happy to be joined by some of my colleagues. And next up will be the treasurer from the state of New Mexico, Laura Montoya.
Good treasurer.
Good afternoon, everyone. My name is Laura Montoya, State Treasurer from New Mexico. We must rise to the occasion to discuss the harmful implications that these budget cuts have on some of our most vulnerable populations. Speaker Mike Johnson and the House GOP's recently passed budget, which includes cutting Medicaid by $880 billion for the next 10 years, will have disastrous consequences for the vulnerable New Mexicans and Americans across this country. To put it into perspective, New Mexico has more Medicaid recipients than anyone else in the United States. We have approximately 33% of our state's population relying on Medicaid, or CHIP, also known as Children's Health Insurance Program, to cover their health care. When the federal government slashes funding, hospitals, doctors' offices, clinics that depend on these funds will be forced to either raise premiums and co-pays for patients or shut down. This is even worse in our rural communities. Small businesses that provide health insurance for their employees will also be forced to pay more for their employee benefits if they can continue to provide health insurance at all. It's exhausting to hear Congress talk out of both sides of their mouth. On one end, they're saying that they care about veterans, they care about small business, they care about kids, they care about families, but all of their actions are showing everything but that in doing these types of cuts. This shows a lot of fear for a lot of people. Right now in our New Mexico legislature, which we're currently in session, Senate Bill 88 is being proposed to help Medicaid trust fund within New Mexico to help supplement this mess that Congress and the president are doing. It's reckless, and in no doubt, it harms communities. Congress cannot be that oblivious to not know the devastating impact this policy has on the very people that elected them to protect and defend them. This budget cut reveals a deep-seated disregard for humanity. And I will say, coming from New Mexico, I know this is mostly about Medicaid, but our Mexican tariff situation is detrimental to our community. We're second in oil and crude production. We have issues with the uranium and the steel tariffs because it hurts our and impacts our oil and gas, and it hurts our medical equipment that we need to get from Mexico. And it also hurts the uranium that our military bases and our Los Alamos labs and Sandia labs utilize. So all of these types of effects are very critical to the relationships and the collaboration that we're used to having. Our government is supposed to be for the people and by the people, and this shows nothing of the sorts. So I'm hoping they'll get it together, start realizing how much they're negatively impacting our economy and our people. Thank you.
My name is Mike Pellicciotti. I'm the treasurer of Washington State. Look, it is getting harder and harder for working families to get by. We are hearing today about the impacts of tariffs, how that is affecting folks throughout the country, but especially Washington State is becoming particularly pronounced because we border Canada. I mean, we're hearing about how agricultural prices are going up, how it's getting harder and harder for major industries like our agricultural sector to even get the fertilizer to produce products that are getting more expensive. I say all this is because every day it's getting harder and harder for working families to get by. And Congress, instead of responding to the cost of living issues that are facing the people of the country, is instead talking about increasing the cost of healthcare, removing healthcare, adding additional anxieties and stress to the everyday Washingtonian and everyday American who is just trying to survive every day. And the idea of impacting Medicaid and reducing Medicaid exposure and opportunities for healthcare for folks throughout our country is going in the wrong direction. It's making it that much harder with folks. And the number one indicator of healthcare's negative outcomes today is economic stress. So folks are facing more and more economic stress today because of tariffs and other policies coming from the administration, and then turning around and now having to face the fact they don't get the healthcare services that they need. In Washington State, nearly half of Washingtonians receive Medicaid services. In my communities, it's 2 out of the 3, and in several of our 39 counties, and our rural counties in our state, it's 3 out of 4. This is incredibly impactful. It's moving in the wrong direction, and at a time when it needs to be easier for folks to be able to get by, these actions by Congress are only making it work. I'll turn it over to Treasurer Russell.
Good afternoon. My name is Erick Russell. I am the State Treasurer in Connecticut, and I'm proud to be standing here with my colleagues today as we look at the fear and danger that is being proposed with this budget and with cuts to Medicaid. In Connecticut and across this country, working families are struggling. People are struggling to put food on their table. They're struggling to pay their bills, to have access to the care that they need. And what this budget does is further that problem. In Connecticut, 800,000 people are covered by Medicaid. These are some of the most vulnerable in our community. The elderly who are dependent for long-term care, young people in our state, children, and nearly half of the children born in Connecticut every year, their birth is covered by Medicaid. What we've seen over the last 6 or 7 weeks has been chaos and uncertainty. We're seeing that reflected in the market right now, in the economy, as people are slowing down, not sure what the future holds. But what we know this budget will do, and these cuts to Medicaid, is have devastating effects on our communities all across Connecticut and across the country. And it's consistent, as we have a president that ran on bringing costs down, lowering inflation, making food more affordable, right, bringing down grocery prices. The policy that's been reflected to this point has been the exact opposite, and that's what we are seeing furthered in this budget. When we think about inflation, it's the trifecta of inflation from a policy perspective. We're looking at tariffs, including tariffs that have been waged against some of our closest allies that are sure to increase energy and electricity costs for families in our communities, that are going to drive up the cost of food. Mass deportation policy that is going to impact our labor market, making it more costly for businesses in our states and in our communities. And what is sure to be a growing deficit, as we've seen this budget is proposed, is not balanced, and it's not going to continue to move forward priorities for working families. We have to step up, we have to sound the alarm, and we have to do the work necessary to keep people in our communities at the forefront of this budget, and understanding that the backdrop of all of this is so that Republicans can pass a $4.5 trillion tax cut for millionaires and billionaires. And it's a Our budget needs to reflect our priorities and people in our communities, and we hope that everyone steps up and pushes back against corruption. Thank you. With that, I'd like to introduce the Treasurer for Vermont, Mike Pieciak. Oh, please.
Well, good afternoon, everybody. Thanks for being here. I'm Mike Pieciak. I'm the State Treasurer in Vermont. Really honored to be joined with my colleagues here from across the country to talk about this important issue. You know, Medicaid is a critical program in Vermont. 160,000 Vermonters rely on Medicaid for their health insurance. Elderly people, pregnant people, young people, across the spectrum, Vermonters rely on Medicaid. It's critical to our rural communities in Vermont. It's critical to rural healthcare access, that people have access to health insurance, and particularly to Medicaid, which provides access to healthcare for so many people in our state. And when we talk about the cuts that would happen with Medicaid based on what the Republicans have passed, it would mean $2 billion would lose from Vermont. We'd lose $2 billion. There's a significant impact to those that rely on this as a program. It's significant to the employers that employ them. It's significant to those qualified health centers that are critical to providing rural access. It's critical to our economy. So it's really would have horrible impact to both the individuals, their families, and more broadly to the economy as well. And when you think about this issue from a political standpoint, you know, it really makes little sense as well. Vermont, one of the states that voted most overwhelmingly for Kamala Harris, and West Virginia, one of the states that voted most overwhelmingly for Donald Trump, both significantly rely on Medicaid. 22% of Vermonters are on Medicaid. 28% of people from West Virginia are on Medicaid. This is an issue that cuts across blue state and red states, that impacts everybody, again, at their kitchen table. And when you think about why are we doing this? As my colleague, Treasurer Russell said, it's not because we're fighting a war. It's not because we're battling back against a pandemic. It's not because we're in a 2008 recession. It's so that we can provide more money to billionaires and millionaires. So the why on this is really confusing. And the last point to think about is Vermonters, Americans have paid into these systems, paid into Medicaid, paid into Medicare, paid into Social Security. We have paid in our taxes and we expect to receive services back as a result. This program would take that money and instead of paying it back in services to Vermonters and to Americans, would put it into the pockets of billionaires. So again, really appreciate everybody being here today to hear about the impact on Vermont and on all of our states. And